People don't really think about climate change as a health risk until it's glaring them in the face, until you are inhaling smoke from wildfires or battling a hurricane or the floods where you can't access your medications or go to your primary care appointment that you had next week.
So that was Liz Carey, a registered nurse that we spoke to last summer about health and climate change.
Right, and now just this week, the American Medical Association has officially declared climate change a public health crisis. Meteorologist Elisa Raffa is here to break it down for us now. And Elisa, this could have a big impact in many ways.
Yeah, so not surprising that they're going ahead and calling it a public health crisis. And what they did is they drafted policy that calls for a decrease in greenhouse gas emissions, a greenhouse in those carbon emissions, to limit our warming to 1.5 degrees, which is what the Paris Climate Agreement also aims for. So yeah, so shifting rain, warming temperatures, wildfires leads to things like physical health, heat stresses. We've been talking a lot about heat sickness this week.
Yeah.
Allergy season, we talk about that a lot too. Even mosquito days, right? They love the heat, those mosquitoes, so those viruses can spread more too.
Yeah, and we do know about that warming, and we did hit our 100-degree mark today, so tying a record. Are there any other health impacts that we need to know about?
Mental health, and I think it's something that you often don't think about when it comes to climate change, but there's a lot of new research that shows that this is a problem because extreme weather is increasing in frequency. Take a look at this graphic. The number of days between billion-dollar disasters is decreasing. So you see how those bars are getting smaller? That is the number of days in between disasters. So you just don't have time to cope with stress and loss in between these disasters because they're increasing. So the American Public Health Association actually reports that more than half of adults report suffering from depression after disasters, and 45% of kids too.
Wow. That makes sense because they're big events, and then when you don't have the time to recover from it, it just compounds on itself.
Right, and it takes people so long sometimes to recover from those kinds of events.
And that's stressful too. And then even, like Liz Carey was saying too, road closures after flooding, things like that.
Yeah.
If you had a therapy appointment, because you're suffering from something, you can't get there now if there's no power or the roads are closed or things like that. There are a lot of compounding kind of trickle down issues when it comes to this.
Yeah, so Elisa, what's kind of next? What do we do with this information?
So doctor's orders, we have to reduce those greenhouse gas emissions. And I think us in our everyday lives is to kind of pay attention to the reports as they come out, and every time the election cycle comes around, just pay attention to these issues and who has plans to kind of limit the greenhouse gas emissions, because that's what's causing these problems.
And there's lots of data that you can easily find anytime, lots of resources out there to kind of dig into that data yourself. So Elisa Raffa here, always informing us about what's going on out there. So we appreciate you.
Thanks, Elisa.